member for Paterson. Call the member for Bowman.
Thank you, Deputy Speaker. And as I raised in this chamber 2 weeks ago, the Eagle needs to be sent home. And Cigna NIB, in a recently announced collaboration, have formed this joint venture under the term, ironically, Honeysuckle Health, with the intention, obviously, of working towards some minimal cost savings, which ultimately can, in the end, and we know from US experience, harm patient care. These contracting groups that we have seen from the US are basically a bundling value-based contract, and it basically puts the hands of insurers on the clinical decisions in between the doctor and the patient. And it's a bad precedent. I'm deeply concerned because I've seen what's happened in the US, and if there's one thing to say about the US health system, it is that they have struggled to rein in costs. Look, eventually these network care arrangements, they produce these silos of non-overlapping care where patients are locked into narrow and separate providers, and increasingly cost and restrictions and multiple tiers lead to limits in choice. I want to give you some examples. An additional $10,000 to transport a patient to a hospital that's not in the network, an additional $36,000 of healthcare costs because you're transporting someone to a hospital that's not in the network, an insurance administrator who basically scurries around hospital corridors looking for patients to discharge against medical advice because the beds aren't there and the company bed count has been exceeded, a gynaecologist who claims that a patient needs a hysterectomy, but they have to wait until the haemoglobin level falls to a particular point before the insurance company allows them to proceed. The need for insurance pre-approval, remarkably, before an operation can be performed. And we require permission again from an admissions clerk, and the breast cancer procedure performed by a general surgeon rather than a breast surgeon, and then reconstruction being done by a surgeon who's not qualified in either plastic or breast surgery. It's ironic they use the term honeysuckle health, Deputy Speaker, because we all know here in Australia that honeysuckles are an invasive and pestilent species, recognised as such in North America and across Europe, and the way to treat an invasive pest of this kind, obviously, is generous doses of glyphosate. And we're asking this chamber and this nation to recognise that we shouldn't need to resort to such extreme measures, because a simple piece of legislation that I know would have support from the other side of the chamber would simply mandate that we keep this important competition between providers and hospitals. The purchaser-provider split is a very important part of high-quality and contested work. The last thing we want to see is private health insurers purchasing into hospitals and promising early on no-cost and low-cost services for very simple cases, because we know ultimately it is the complex cases that can blow out and cause extreme out-of-pocket pressures on patients. No to honeysuckle health, no to deals with our Australian healthcare providers, and let's send the Eagle home.